Welcome to Wonder Hair Career Institute Online. My name is Livina and I'll be your instructor for today. Today we are going to talk about measuring and recording respiration. Let's look at our checklist. On the day of your exam, the instruction card will read like this. You are asked to count the resident respiration. The respiration should be counted for 1 full minute. A measurement form is provided to record the resident respiration rate. Now, the role of the patient is played by a person. It's not mannequin skill. What is respiratory rate? Respiratory rate is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 full minute by counting how many times the chest rises. One respiration consists of 1 inspiration and 1 expiration, or 1 inhalation and 1 exhalation. This is important to note. Now we have the checklist. We'll start counting from number 3. It says measure rate of respiration without providing instructions to residents about how to breathe. When you're going to do respiration skill, remember you must not tell your patient that you want to count his or her respiration. Then what will you tell the patient? I'm here to take your vital signs. Why you don't want to tell your patient that you're counting respiration? Remember, the patient might alter the respiratory rate and you will not get the correct measurement. Count respiration for 1 full minute. Record respiration rate on measurement form within plus or minus 2 breaths per minute of nurse's measurement. Again, this is our measurement form. This is how it looks like. When you finish counting the respiration, remember you must wash your hand before you touch this paper, before you record. So when you get your number, you must put here whatever you get, breaths per minute. The paper has per minute already, so you must put breaths per minute. Remember, on the last video we talked about the pulse. Pulse rate is beats per minute. If you put beats per minute when you're supposed to put breaths per minute, remember it is not the same and you will fail this skill. So you must know the difference now. Pulse rate is beats per minute, respiratory rate, breaths per minute. If you make mistake of put something different, remember it will not mean the same thing. Now let's ask 1 or 2 questions on this respiratory rate. I've already said when you want to count the respiration, you don't want to let the patient know you are counting his or her respiration. What will you tell the person? You are here to do vital signs. What are you looking for when you are counting respiration? Rise and fall of the chest. 1 rise and fall of the chest is what? 1 respiration. 1 rise and fall of the chest, 1 respiration. 1 rise and fall of the chest, 1 respiration. Now, 1 rise and fall is what? Inhalation and what? Exhalation. That's when that chest is rising and falling, and is considered 1 respiration. There is not too much to talk on this particular skill. So let's go and answer 1 or 2 questions. What is the normal respiratory rate for an adult? Between 16 to 20 breaths per minute. If you take your resident vital sign and you notice that the respiratory rate is below 12 or above 20, what will you do? Report to the nurse. How should a resident with COPD be positioned? I hope you know what you mean by COPD. Emphysema, people that have emphysema or bronchitis. Okay? So let's see if somebody is not breathing well. How will you position that person? Are you going to lay that person flat on his back? Are you going to lie that person on their stomach, on their side, or upright position? The person must be sitting upright. That makes breathing easier and better. If you walk into your resident room and she said she cannot breathe, what is the first thing you have to do? Let's say the person is lying flat, whether the person is on oxygen or not in oxygen, or whether the person is on oxygen or not. What will you do first? Raise the head of that bed up and then go and notify your nurse. A resident who is lying in bed suddenly becomes short of breath. After calling for help, the nurse aide next action should be what? Remember what this thing said? Suddenly. After calling for help, you don't have to run from one unit to the other. There is call light there. When you say calling for help, doesn't mean you have to run from unit A to unit B to go get somebody. Hit that call light. The call light means somebody need help. While you are there, hit the call light and then raise the head of that bed. That's all you have to do as a nurse aide. What is one respiration? One respiration is what? One inhalation and one exhalation. Or one inspiration and one expiration. That is what? One respiration. Thank you for watching. I hope you enjoyed these little tips. If you do, please subscribe and hit the notification button. Good luck in your exams. Thank you.